of the age. The third factor that we consider here is body surface area. This is widely accepted by physicians worldwide, globally, because they believe the age has issue. I will tell you the issue it has. The weight has issues. I tell you the issue it has. If you talk of the age, you can see a child that is 7 years old that has a very big body that it can even weigh more than a 30-year-old adult. And you, because of age, give a minimal dose of drugs, you may end up not helping that child at all. So age is not accepted as a factor again universally. Likewise, weight is losing its effect too, because many factors were considered when talking of weight. But what is globally accepted is body surface area, simply because this one takes care of entire human being. You weigh your height against your length and your breadth. So that is what together to form your body surface area. And it was mentioned that every adult has 1.7 meters square as body surface area. Very simple. If you are dealing with anybody, want to use this one for, and what you just do is that you just say surface area of the child. You do that in infant welfare when you measure the tape with the tape to see the length of the child, see the breadth. What together we give surface area. Surface area of the child all over 1.7 meters square multiplied by adult dose, like we said the other time. So if the child now has the area of 0.85 meters square, all over adult is 1.7 meters square multiplied by 1000 milligram of paracetamol. So here 1, here 2. So it means it is 500 milligrams. You can see that calculation is important now. This is how you calculate what the patient takes. So we have looked at the age, we have looked at the weight, we have looked at the body surface area. And let me tell you that it is considered globally that if anybody is above 150 pounds, don't use its weight again as a yardstick. Use body surface area. Let me say that in some instances, when some patients are very apprehensive, they are very anxious, you can't give them dosage of normal drugs and it will work. It will not work because metabolism in that time is very, very high, and drug works with the body mechanism. So when you look at the patient's physical and emotional condition, you may need to increase amount of drugs you give at a particular point in time. So it's also a factor they consider in making a decision on how more drug a patient gets for any form of ailment. Apart from that, you look at the disease condition. Disease condition will affect what patient gets. I'm talking of severity now. How severe that disease condition is may affect what it gets. For example, if you're talking of antibiotics now, in many conditions you give more than usual. Like in orthopedic conditions now, because bone infection is very disastrous. So you give more. Somebody who should take 100 milligrams of any ampicillus or whatever could be asked to take that times 3 of that because of the severity of that condition. It's also a factor to determine how much drug you give. Apart from that, you look at the drug history and allergy. Drug history and allergy. Also form important role in how much drug you give to a patient. When you talk of drug history, it means maybe he has taken it before, what has he taken, then how does it work for him? So that will show you that you can give him more or you retain what he was taking that worked for him. Then you look at tolerance. Tolerance is because someone has been taking drug for longer time. You seem that it's not working for him again. It has to be increased. If someone now say, I prescribe to a patient to use 1.5 gram of paracetamol. I don't know what he's saying. It should be 1 gram. No, it should be 1 gram. Because the person has taken this paracetamol for long, it's not working for him again. So you have to increase that dosage to make it work for him. So that is very, very important when you are determining dosage of drug in every patient. So with all this, we are trying to say, we are trying to let us know that if we want to talk about drug and this dosage, do not put in your head that it must be constant. And I'm telling you now, what and what will not make it constant. These are things that will not make it constant. Because when you consider all those factors, you will see that it is not the same dosage of drugs you give to different individuals. So prescription is based on individual. It's never based on uniformity that everything must just be the same for every individual. So that is what I'm trying to bring out here by telling you all this I am saying. So with this, I believe that you have understood a little thing I have tried to pass across to you. And let me just have your feedback about this and see how it helps you. And like I've said, we are teaching you principle. Your course outline will not allow you to do psychology in detail, but because what you need to do is you just need to familiarize yourself with what you are familiar with in your place of work in terms of drugs you use. Not that you can know every drug that we have in the market. It is not possible. So, but all these basic people are talking about is what you need to improve your knowledge of the course in pharmacology. Now, having said that, we have seen how drugs look like, we have seen how it works, we have seen forms of drugs, we have seen all those things that we need to know about drugs. But then, the only area we are going into is area of pharmacokinetic and pharmacodynamic. The two areas are very technical areas because when you take a drug, you must know what drug does to the body. You must know what body does to the drug. So that is why you have the two words, pharmacokinetic, and you have pharmacodynamic. You know, when you talk of kinetic energy in your chemistry or physics, in physics, they will tell you it's energy of motion. That is movement of drugs from the point of administration till it gets to the bloodstream, and until it gets out of the bloodstream, out of the body. So when you are discussing kinetic now, you are talking of how the drug is absorbed, absorption of drug, how the drug is distributed around the body, then how the drug is metabolized, and how the drug is excreted. Because when you take a drug, it has both useful and useless components. So that drug you take must be absorbed into the bloodstream before it starts taking effect at all, and must be distributed. That distribution is to the area where the drugs are needed. I told you of receptor other types. So metabolism is where the drug will be metabolized by the liver. We extract the toxic part of that drug for excretion. So excretion is mainly by the kidney. So when you are talking of pharmacokinetic, these are things you are talking about, and they are very simple things that moment you can discuss you can discuss digestion of food very well, then you will know that the drug you take follow the same process and the same pattern. When you talk of absorption, it is the fact that when you take medication, maybe without use of oral, because we can't use IV. IV goes to the bloodstream directly. But oral drugs that you take, even the IM, they undergo some forms of processing before they get to level at which they can exert effect on the body. And let me say that absorption of drugs will only take place or mainly take place in the small intestine. Well, when we talk of absorption, like I said, that drug gets to the small intestine before it is absorbed. Drugs were compounded to work that way, and because there is no area in the GIT that has a larger lumen as in small intestine, it just passes through other areas till it gets to the small intestine. Let me say that this has some implications. There are some tablets you take that are not meant to be chewed. When you chew them, you have altered their physicochemical composition, and that may be a problem for absorption. When you take a capsule that has gelatin cover, the purpose of that is that the content of that capsule can be destroyed by the stomach acid. That is why they put that cover at the back. If you open that cover and you swallow and you take the powder inside that capsule, that drug will not work because the stomach acid will destroy it. I've told you that before, just to remind you. Absorption of drugs, like I said, mainly take place in the small intestine, and it takes about 4 theories to describe how absorption takes place. You know, the first theory is what they call, you can say you have passive diffusion. Passive diffusion. Second one is what they call facilitated passive diffusion. The third one is what we call active diffusion. And the last one is called pinocytosis. Now, when you say passive diffusion, it means when the drug gets to the luminal wall of the small intestine, because of the fact that the larger form of that drug is in the small intestine, it's very easy for this drug to get into the bloodstream where there is no amount of drug in. So it will just form from the area of larger concentration to area of smaller concentration, from higher to lower concentration. So the intestine where you have the drug now are the highest. The bloodstream where it is going are the lowest. So it is very possible without any force at all for this drug to pass through this wall directly into the area of lower concentration. That's what they call passive diffusion. And you talk of passive diffusion that is facilitated, it means there is a carrier molecule like in glucose that you have in the bloodstream that tally with the carrier molecule in the drug you take, and they both see each other, they attract to each other. So it is more faster even than passive diffusion. Both of them does not require any energy for them to get into the bloodstream. And that depends on the composition of the drug you take. That drug must be at least lipid soluble. because the cell wall of every human being has lipid component. So it is very easy for lipid soluble substances like drugs to enter into the bloodstream without any form of forces. But if it is active diffusion, it means that drug you take has a form of protein component. It has amino acid component, and that one will not get to the cell like that. It has to walk around the cell to break down all the protein component before it can enter the bloodstream. So that forces that you need before it can get the smaller pieces to get the bloodstream is why they call it active diffusion. It means it is very active. It requires forces for it to do that work. The last one is pinocytosis. That some cell has a kind of ability for drugs that they just open their mouth like this and engulf the drug. So they call it pinocytosis. Be as it may, any drug you take will follow these 4 patterns to get into the bloodstream for absorption to take place. That is what we call absorption. Now there are some factors that we consider that may either influence the absorption of drugs. The first factor is what we call physico-chemical property of the drugs. Second one is routes of administration. The third one is forms of drugs. And the fourth one is rate of gastric empty. Now, when you talk of physicochemical property factors that influence absorption, when you talk of physicochemical property of the drug, physical, how the drug look like. Let me example. Tablet is a physical component of a drug. Tablet is solid. You take syrup, it's liquid. So capsule is solid. So that component affects how the drug is absorbed, because the liquid one will get to the small intestine faster and be absorbed faster than the solid one. That is chemical property. That shows if that drug is either lipid soluble or protein soluble. A lipid soluble drug gets absorbed faster than protein one, because protein one we have to use active diffusion before you get to the bloodstream, like I've told you before. Route of administration matters a lot in absorption. The drug you take by IV directly go to the bloodstream and does not to go through any form of absorption again. So the drug you take per oral will take a longer time to get to the bloodstream, because it must go through the small intestine before it gets to the bloodstream. So the route of administration is a factor to absorption. Number 3 is form of drug. Like I said, form of drugs now has to do with, is it tablet? Is it liquid? Is it suppository? Is it pastry? So any form that you take the drug affects the rate at which that drug is absorbed. Then rate of gastric emptying is a factor, very good factor. There are some people that if you use laxative now with some drugs, laxative will work, those drugs will not work, because the rate at which they will pass through the intestine is so fast than normal. So because the motility of the intestine will be increased by this laxative and will affect the rate at which this medicine you take alongside will work. So rate of gastric emptying, the faster the gastric emptying, the faster the drug will go. and will not stay in the small intestine for a number of times to stay to make it more effective. That is what they talk of when you say rate of gastric emptying. Let me say that there are some other factors that are considered not so important, but they are still important. The content, the drug you take alongside that drug will also form an influence for absorption of that drug you take. Then the component of the GIT, maybe that component may be food or even another drug in that GIT. When you take the drug, they will affect the absorption of that drug at that particular time. So these are what we talk about when we talk of absorption of drugs in a very simple language, because I don't want to bother you much with the detail of that. So just know that absorption can follow any of the four processes: passive diffusion, passive diffusion, anti-diffusion, and then pinocytosis. And the factors that can influence the absorption are what I discussed with you. So we talk of distribution, we talk of metabolism, and we talk of excretion of drugs when we meet next on the Zoom meeting. I think this little video will have assisted you a bit to understand what we are trying to discuss. Well, I will still be expecting your comment, reaction, and questions on what I've said so far, and I'm going to answer that for you. Like I told you, we are two to handle this course, and second portion will take over when I feel like stopping, and then maybe that will be when it will take you some of this drug on systemic basis. So thank you again for watching this little video, and I wish you all the best of luck. Thank you very much, and stay blessed.